start, I want to take just a little, a couple of minutes to talk about the adductors and more specific, well, two little topics on that. For one, I know we've talked a lot lately about hamstring control and support for the pelvis hip area in relation to the pelvic floor. A lot of us will tend to also hold tension in our adductor. So our inner thigh, our groin area will feel like they're always tight or they're always contracted, or for some people, obviously pain can be there. And if you're like trying to do a Kegel or trying to activate certain pelvic floor things, sometimes you're feeling it in the inner thighs. So I want to touch on that a little bit because the pelvic floor does work really well and really importantly with the adductors. The adductors are, not only do they share like fascial or overlays with the pelvic floor, but where the adductors attach, some of them attach like literally on the pubic bone or like the ischial region, and then they go into the inner thigh. So if you think of the external aspect of the pelvic floor, this is a bunch of adductor muscles that come down and support us from the front and from the inside. So when we think about adductor tension, sometimes it's because they're weak. So chronically tight things are weak things. So keep that in mind. If you're chronically tight in a certain area, adductors, hip flexors, any other muscle group, that can signify that they're weak. A strong muscle should be able to relax. So that's where the value of understanding neurologically what's going on with the adductors and also strength-wise what's going on with the adductors can be important, because I think oftentimes if we're having tension in our adductors or if we're feeling tight in the groin, it's like, what stretch can I do? How can I alleviate the tightness or the tension? Understanding that if those muscles were strong, they would actually be better able to relax. So it wouldn't feel as tense. And sometimes the reason the adductors can be so tight or hold a lot of tension is because they substitute for a lot of the primary pelvic floor function, meaning they can just be a little bit too helpful to help with stability. And when this happens, that can then decrease how the deeper pelvic floor muscles are showing up to do their part. So that can happen in some cases. In other cases, they're really great at co-contraction. So strong adductors help the pelvic floor contract and work better. So understanding just not necessarily if you're one or the other, but the fact that the two play an important part together can be huge. And also understanding that what I just said, contracting the adductors can literally lead to opposite things. Right? So that's where the fun of the muscles, like the creative outlet of the muscles can occur, because sometimes we can literally do the same thing and get opposite results depending on what else is going on. So if we want the adductors to be strong, we want them to be strong and independent and do their job separate from the pelvic floor muscles. And that's why for a lot of us, if we are having pelvic floor limitation, so we're not a 3 out of 3 on all our initial pelvic floor assessments, that's where we want to focus first on the pelvic floor muscles because they're deeper and because they help support that foundation. Because once the pelvic floor muscles can do what we want them to do, it allows the adductors to then be a little bit more optimal in what they do. And we want each section to work well independently. And then we want to teach them how to work well together. And so if we can't really teach the adductors to work with the pelvic floor if the pelvic floor doesn't yet know how to work by itself. And so that's where the order of things can be important, where you're feeling things or what your symptoms are telling us in one position versus another can also give us some good insight into, is this because the pelvic floor or something deeper foundationally isn't where it needs to be? Or is it because we're at the point where we need to teach the two to work together? So tracking obviously symptoms if you're having chronic tightness or pain, or maybe certain exercises feel really good. Other ones are like, either I'm not feeling what I think I should be feeling, or I don't know if I'm doing it correctly. That's kind of where we really want to focus our efforts, especially at this first phase of the program. These first few months, we're really trying to understand your body, give it the tools that it needs to feel good and to respond in a way that the stuff we build on later on in the program actually has the opportunity to be effective. So that's all I really want to kind of educate on as far as abductors go today. I mean, obviously, if you guys have specific questions, I want to be able to guide you, individually, so that you have something to work on or something to pay attention to. But I just wanted to make sure that you guys could understand at a fairly general level why just stretching adductors or just stretching tight muscles isn't necessarily going to be a lasting solution. And why we want to kind of dive a little bit deeper and work a little bit more dynamically in the front part of the body, the same way that we've talked about working with the deeper hip rotators, the hamstrings, the glutes, and those types of muscles in regards to the trunk and the pelvis and the hip. Another thing too to keep in mind, because I mean, stretching isn't necessarily bad, right? Some people, you guys do stretches and it feels good, or, it's something you like. That is okay. It's just going to be a very short-term effect. It's not going to last. So recognizing like, yeah, I can do this, just don't expect it to translate over into, 10 minutes later, an hour later. Like that's not what the stretching is going to do, because it's a little bit more just muscle tissue based, the effects, as opposed to the nervous system musculoskeletal conversation. And so, and again, this is in regards to chronicity, right? So if we're chronically tight in the adductors, we need to lengthen them, right? We do that with our breathing. We do that with our eccentric strengthening. We do that with dynamic exercises, because that is working on the nervous system to understand how to utilize and load through that muscle group in a more effective way. The lasting effects come from the neurological changes. So the nervous system changes. And so that's where, our mobility is a little bit more dynamic, or the breathing or the strengthening that we'll have you guys do. There's very little, if any, static stretching that we have you guys do throughout this program, because it's a very short-term effect. So just understanding too the difference of, doing a static stretch, working on the muscle fibers themselves and how it's going to be a short-term effect, versus something a little bit more dynamic or loaded is going to have a more long-term effect, because how it works on the nervous system to then work on the muscle system.